Your baby's jaundiced, your baby's yellow. What does that mean? Everybody always talks about jaundice or your baby becoming jaundiced, but what does jaundice even mean? Stay tuned and we'll talk about it together. So commonly, parents, nurses, pediatricians often discuss jaundice when it comes to babies, specifically newborns. And when we're talking about jaundice, parents can often identify it by their baby looking a little bit more yellow, perhaps even having yellowing of the white part of your eyes, which we call the sclera. And parents can often be very worried, especially because this is a term you don't commonly hear unless you're in the medical field. And once you become a parent, you're going to hear it a lot because we check babies for jaundice not only before they leave the hospital, but at their first checkup at the pediatrician's office, and then a few days afterward when we're seeing you again for follow-up. So jaundice happens when a baby has an elevated level of bilirubin in their bloodstream. Yes, that is a very funny sounding word, bilirubin. When I was younger, my mom was a pediatrician and I would often hear her say this word on the phone to the on-call answering service, and I was just like, blah, like, blah, blah, like I thought she was speaking gibberish. This is a real word, and essentially it is actually a breakdown product of red blood cells. So it makes sense that it would be in the bloodstream. Typically, there is a normal functioning level of bilirubin in the bloodstream, right? Because our red blood cells are always being broken down and then new ones are being made. So we do see bilirubin as a normal byproduct in the bloodstream. Now, when it becomes something that we talk about when it's termed jaundice in the baby is if it's elevated. And this can happen in the newborn earlier days for a couple of reasons. One, there's a high amount of blood cell turnover when a baby is first born. So think about it. Not only are they born, but there's a lot of trauma with a delivery going on, not necessarily what type of delivery, but just generally, delivery can result in red blood cell turnover. The second thing is the liver enzymes that conjugate and then get rid of bilirubin are immature in a baby and take a couple of days to sort of kick into gear. Something that helps them kick into gear is actually being able to digest because the liver secretes enzymes into the GI tract. So the more milk a baby is getting, the more the liver enzymes have a chance to work, and then they're able to pass that bilirubin as a byproduct into stool. That's a threefold reason why you sometimes might see jaundice, especially in a newborn. Specifically, if that newborn baby might be having difficulty taking in milk or mom's milk supply hasn't kicked in yet, well, the bilirubin doesn't have a way to really move through the system because it is pooped out. Now, this is actually a common reason why we start to see stools transition or turn more yellow or mustardy because the jaundice is actually moving through the system and then being excreted or pooped out. Now, what happens if jaundice does not move through the system? What happens if bilirubin instead builds up in the body? Well, this is the reason why doctors, and specifically pediatricians in the hospital, before your baby goes home, and even outpatient when we're seeing your baby and we're concerned about jaundice, are checking those levels. Because we want to prevent something called kernicterus, or elevated levels of bilirubin crossing into the blood-brain barrier and then causing devastating consequences for the baby. These consequences can result in coma, encephalopathy, and even death. This is something that thankfully is pretty rare in the United States, but is something that can occur in other developing nations and other parts of the world. It's really important to understand that this is the basically end-all be-all what we're trying to avoid when it comes to jaundice and bilirubin. So if you feel like your pediatrician is asking you about how feeds are going, what the color of the baby's poop is, how you feel like their energy levels are, that's what we're trying to hint at. What is the jaundice doing to the baby? How high are the levels? So let's say your baby's jaundice levels actually are getting pretty high. Their bilirubin is elevated and your doctor thinks that we need to act upon this. There's certain things that we can do. So some things might be feeding baby a little bit more frequently to help get those stools moving across and help get that jaundice level down by having the bilirubin excreted into the poop, essentially pooped out. The second thing, and this is something we might do for more drastic measures if your baby is no longer able to keep their levels down in outpatient, is actually admit them into the hospital for phototherapy. This can seem really scary, so let's talk about what phototherapy is. Phototherapy is actually light therapy that we apply to baby that helps decrease the bilirubin levels in the body. During light therapy, baby is actually very comfortable. They're stripped down to their diaper. You can still hold baby for nursing. You can still play with baby, like hold their fingers, hold their hands, but essentially you wouldn't want to try to keep them under this light, which is helping to bring down the levels of bilirubin in the body. In some cases, light therapy can actually be done at home with something called a Billy blanket. So this device is great because essentially is almost like a blanket format that you can wrap the baby in and still apply phototherapy. So these are really important things to know that you might hear or come across if you're a parent, especially if you're a parent who is concerned about your child having jaundice. The word phototherapy or being admitted into the hospital right after you were discharged, it can sound very scary. It can sound like a lot. Thankfully, these are admissions that typically go very well because the baby is able to feed. We are able to monitor those jaundice levels, bring the bilirubin down, and then get baby home safely. If you have any questions, make sure you ask them below. If this video was helpful, give it a thumbs up. And if you've had a baby with jaundice or you've ever been admitted with phototherapy, let me know in the comments. Would love to find out what your experience was. Hope you guys have a good week. Bye.